Well, there's some big things happening at Tri-City Medical Center in Oceanside. Here to tell us all about it, CEO Tim Moran. Tim, you have got to be excited about the news that you at Tri-City are joining forces with UCSD Medical Health Centers.
Well, we're all very excited. The board, the leadership of the hospital, and our employees and the medical staff. This is a great decision that's been made to work together with a world-class organization and give us an opportunity to do a lot more for our patients in the community.
Why decide to affiliate at all?
Well, the way healthcare is advancing today, you're noticing insurance companies and providers joining forces either through mergers or acquisitions or affiliations to be stronger players, if you will, in their markets. And the board at Tri-City recognized that we would have a stronger future, a better opportunity to take care of more of our people in our community if we had a strong relationship with another provider that had similar values and goals.
Of course. So that leads me to the question, why specifically UCSD?
Well, we have excellent choices in the number of providers that are in San Diego County. We're very fortunate. I think fundamentally where we came to the conclusion that UC would be a good affiliate is we're both public entities, we're both publicly spirited for our communities that we serve. We like the fact that UC trains our future physicians. We would like the idea of being a part of that. And it's important to us to be able to bring into our community the types of physicians that we need. And UC was able to help us with those goals.
Yeah. Now, besides what you just mentioned, what are some of the other changes we're going to see at Tri-City?
Well, we have a lot of work that's going to be done. We're in the middle of working on a campus development plan, and our relationship with UC will help us with that plan. And the plan itself will consist of building a brand new emergency room that'll be much more effectively designed to treat patients in a manner that we think they'll really like. We plan on expanding our OB program, and we also have work to do to change out beds that don't meet current seismic requirements.
You're changing the NICU too, are you not? Are you doing something there as well?
Yes, we're involved in a project right now that is going to result in us having private accommodations. Our babies, our sick babies presently, they can't be with their mom with one-on-one care at probably the most vulnerable time in their life. So what we're creating is an atmosphere where the mom can stay with their baby, they can have that bonding that's so important, and it's going to be a tremendous advancement in care for these vulnerable patients.
Oh, that's huge. How long has all of this been on your radar?
Second day on the job.
And you've only been on the job, what, 18 months?
About 18 months.
Yeah.
Well, I've been in healthcare for 35 years, and when you go around the facility, you can see opportunities. And our NICU unit is very crowded, is very busy.
Yeah.
It's the only level 3 NICU in North County.
Yeah.
So we get little babies from other hospitals in the area, and you could see just looking at it that something needs to be done about that.
Yeah. But
so we got onto that right away.
The affiliation as well. How long have you been eyeing the idea of affiliating with another major health?
That was started on the third day. Well, the board, when I interviewed with the board before I even came, it was clear to me that the board was looking for long-term strategies for the community, and one of the areas that was in the back of their minds was whether we could or should affiliate in some way, whatever that would look like, with another provider. So I started getting to know the players as soon as I got here, so that when we had our strategic planning sessions, we had a good understanding of the market and how we could best put an affiliation together. So it really started right away.
Well, talking about the strategies, what's the strategic terms of this agreement?
Well, there are several elements. One that's very significant is UC Health System is going to take at least a third of the space that we have in the medical office building.
I know there's been a lot of questions about that building.
I get a lot of questions about that building, and now I can start answering them. So that's going to be big, and that'll have an immediate impact as we get going on that. A second area is co-branding. We both benefit from this affiliation, and we want the community to know that UC Health System and Tri-City are working together. There's managed care contracting, working with the insurance companies. We feel that both of us together become a stronger player, and we believe that's going to allow us to be able to have access to more insurance coverages that'll benefit the people that live in our community, so they won't have to travel.
Tim, earlier you touched on the new emergency room that you're planning in partnership with UCSD. Tell us more about that. I'm excited about that.
Well, our emergency room is very busy. We see over 70,000 patients a year, and everybody is kind of in one congregated area. And it's difficult to render respectful, dignified, and private care in that type of an atmosphere. So in building a new emergency room, we're going to take a different approach to the design and create areas in the emergency room that focus on certain types of patients. So for example, behavioral health patients will be in one area with a physician and nursing staff that have a sensitivity, an understanding, and a training for dealing with behavioral health issues in a separate, quiet, private environment. We expect to have an area for kids. Kids have different special kinds of needs.
And fears.
And fears.
Yeah.
And so we want them to have an area that's sensitive, or the atmosphere is sensitive to kids, so that we can provide them the care that they need. And the third area, which is really important to us, is our seniors. Seniors need to be attended to with the dignity and respect that they deserve. So the area that we would like to design that's focused on seniors will probably include softer gurneys, hearing assist devices for those that don't have good hearing, larger font size, and probably as importantly, a physician staff and nursing staff that have a sensitivity about caring respectfully for seniors.
Wow, that is huge. And you're talking about now physicians that can deal with pediatric care and the children, physicians who know about the behavioral issues, and now physicians who know about geriatric care. That's another paradigm shift.
Absolutely it is. And because we see so many patients, we can set up our structures so that we can have physicians that more or less dedicate themselves to the care of pediatric cases or the care of seniors. They don't necessarily have to move from seeing a 2-year-old to seeing an 82-year-old.
Yeah.
And I think it allows us to give care that's really more specific to the patient's need.
That's also got to be very beneficial to the staff, I would think.
Absolutely. The staff, if they're committed to these types of patients, I think they feel good about what they do. And I think ultimately what we're going to see is that the community is going to be very pleased with what their experience will be once we're done and we have the new emergency room in place.
How's the reaction been so far in the community to this affiliation?
I've not had one negative comment. Everybody's very excited about it, and that goes for our employees as well. The board was very sensitive about what the community's reaction would be to this, and thus far all of the comments have been very, very positive. I think people are probably excited about our relationship with UC. It speaks of our commitment to quality and our commitment to doing what we can to take care of people in our community, Talk about some of the other benefits to the community, because not having to travel, the patient care, what are some of the other benefits you see from all this? Well, we're very big on primary care. It's a fundamental need, it's a fundamental issue. Everything starts with a primary care physician. Right. So that'll be an element of what we do. But then there are a number of specialty areas that we hope to be able to address through this affiliation: cardiac surgery, neurosurgery, GYN oncology, and other areas. You'll probably see us announce some things in the general area of eye care, advanced eye care for patients. So it's going to be a lot of new and exciting service offerings for patients that they can access close to home.
It sure is. It sounds like a wonderful paradigm shift, if you will, in what's going on in North County healthcare.
I think that this is probably the biggest decision that's been made, perhaps even since the hospital was built. And I think the affiliation gives Tri-City the opportunity to really make good on its commitment to the community without giving up the independence that's been important to the board. because they believe that they're in the best position to make local decisions with the patients in our community. So we think it's going to be a big winner.
Wonderfully said. Tim Moran, thank you.
Thank you very much for having me.